Hey everyone, Dr. Alpha here. We talk a lot about staying healthy, but sometimes our bodies send subtle signals before things get serious. That's why I'm diving deep into 10 silent signs your body might be in trouble. Those sneaky symptoms we often brush off but shouldn't. Think about it, you're super busy, right? Maybe you chalk up that constant tiredness to a heavy workload or that cough that just won't quit to seasonal allergies. But what if those are actually your body's way of saying, hey, pay attention, something's not quite right. We're going to decode those whispers before they become screams. We'll break down each symptom, explore what it means, and most importantly, when it's time to pick up the phone and give your doctor a call, remember, early detection is key to getting the right treatment and staying ahead of any health challenges. Now let's get started. Alright, let's talk about fatigue. We all feel tired from time to time, right? A late night studying, a long day at work, it happens. But we're not talking about the regular kind of tired here. This is different. This is that bone-deep exhaustion that just doesn't seem to go away, no matter how much sleep you get. If you're feeling drained day after day, even after a good night's rest, your body might be trying to tell you something. It could be a simple fix, like a nutritional deficiency, maybe you're low on iron or vitamin D. These are things we can easily test for and treat, but sometimes persistent fatigue can be a sign of something more complex. The bottom line is, if you're experiencing unusual fatigue that lasts for more than 2 weeks and interferes with your daily activities, don't ignore it. Talk to your doctor. Let's be honest, nobody enjoys talking about bathroom habits, but trust me, this is important. We all have our own normal patterns, but if you're suddenly making more trips to the bathroom than usual, especially during the night, your body might be sending you a signal. One of the most common culprits behind frequent urination is a urinary tract infection, or a UTI. These pesky infections happen when bacteria enter the urinary tract, causing inflammation and that gotta-go feeling. The good news is, UTIs are usually easily treatable with antibiotics. However, frequent urination can also be a sign of something more serious like diabetes. When your blood sugar levels are high, your body tries to get rid of the excess sugar through your urine, hence the increased bathroom breaks. Other potential causes of frequent urination include an overactive bladder, certain medications, prostate problems in men, and even pregnancy. So if you're concerned about your bathroom habits, don't hesitate to talk to your doctor. They can determine the underlying cause and recommend the best course of treatment. Okay, let's be real, most of us wouldn't mind losing a few pounds. But when the weight loss is sudden and unexplained, meaning you haven't made any significant changes to your diet or exercise routine, it's time to pay attention. This isn't about celebrating dropping a size, it's about recognizing a potential health red flag. Unexplained weight loss can be a sign of a variety of underlying conditions, some more serious than others. One of the most concerning possibilities is cancer. Certain types of cancer can cause rapid weight loss due to the tumor's increased metabolic demands, or interference with the body's ability to absorb nutrients. Other conditions like hyperthyroidism, where your thyroid gland produces too much thyroid hormone, can also lead to unexplained weight loss. The bottom line is, if you're experiencing unexplained weight loss, especially if it's significant or accompanied by other unusual symptoms, don't ignore it. It's essential to consult your doctor to rule out any serious underlying conditions and get the appropriate treatment if needed. We've all been there, that lingering cough that just won't quit. While most coughs clear up on their own, a persistent cough can signal something more serious. Think of your cough as your body's alarm system for your respiratory system. A cough lasting more than 8 weeks needs investigation. It could be due to asthma, COPD, or even lung cancer. Consult your doctor to find the cause and get treatment. Our skin is the largest organ in our body, and it's often a reflection of our overall health. We're not just talking about wrinkles and fine lines here, people. We're talking about those subtle and sometimes not so subtle changes in our skin that can signal something's amiss beneath the surface. Think of your skin as a window into your inner health. One of the most crucial things to watch out for is skin cancer. Keep an eye out for any new moles or changes in existing moles, such as asymmetry, irregular borders, color variations, a diameter larger than a pencil eraser, or evolution over time. Early detection of skin cancer is crucial for successful treatment, but skin changes can also be a sign of other health issues. The takeaway here is simple: don't ignore any unusual changes in your skin. Whether it's a new mole, a persistent rash, or even just a gut feeling that something's not right, consult your doctor or a dermatologist for a proper diagnosis and personalized treatment plan. We all know the feeling of being out of breath after a strenuous workout or a brisk walk up a flight of stairs. But what about when shortness of breath strikes suddenly and unexpectedly without any obvious exertion? That's when it's time to pay attention, my friends. Shortness of breath, or dyspnea, is a distressing symptom that can range in severity from mild to life-threatening. One of the most common causes of shortness of breath is heart and lung conditions. When your heart isn't pumping efficiently or your lungs aren't able to take in enough oxygen, shortness of breath can be one of the first warning signs. Conditions like heart failure, pulmonary embolism, and pneumonia can all cause sudden shortness of breath. Anxiety and panic attacks can also trigger shortness of breath, often accompanied by chest pain, dizziness, and a rapid heartbeat. The bottom line is, if you're experiencing unexplained shortness of breath, especially if it comes on suddenly, worsens over time, or is accompanied by chest pain, dizziness, or fainting, seek medical attention immediately. Let's face it, headaches are a fact of life. Whether it's stress, lack of sleep, or that extra cup of coffee, we've all experienced the throbbing pain of a tension headache. But when headaches become a frequent visitor, lingering for days or even weeks on end, it's time to dig a little deeper. Headaches are like the messengers of our bodies, trying to tell us something's not quite right. While most headaches are benign and tend to resolve on their own, persistent or severe headaches can be a sign of an underlying medical condition that requires attention. One of the most common types of chronic headaches is migraines. These intense, throbbing headaches are often accompanied by nausea, vomiting, and sensitivity to light and sound. But headaches can also be a sign of more serious conditions. If you're experiencing frequent or severe headaches, don't just reach for the pain relievers and hope for the best. Consult your doctor to rule out any serious medical conditions and discuss appropriate treatment options. Let's talk about chest pain, a symptom that sends chills down everyone's spine. Chest pain can be a sign of heartburn or a heart attack. Knowing the difference can be life-saving. It's crucial to take chest pain seriously and seek medical attention promptly. A heart attack occurs when blood flow to the heart muscle is blocked. Other symptoms may include shortness of breath, sweating, and nausea. We've all been there, that uncomfortable feeling of bloating, gas, or an upset stomach after a heavy meal. Persistent digestive problems can signal something serious. Your digestive system breaks down food, absorbs nutrients, and eliminates waste. When it malfunctions, it can cause various symptoms. Common issues include IBS, which affects the large intestine. IBS causes pain, cramping, bloating, gas, diarrhea, and constipation. More serious conditions include IBD, celiac disease, and colon cancer. Don't ignore persistent digestive problems. Consult your doctor for diagnosis and treatment. Our eyes are incredible organs, allowing us to experience the world in all its vibrant detail. But just like any other part of our body, our eyes can be affected by various conditions, some more serious than others. Changes in vision, especially sudden ones, should never be ignored. Think of your eyes as delicate cameras, capturing images and sending them to your brain for interpretation. When something disrupts this complex process, it can lead to vision changes, ranging from mild blurriness to complete vision loss. One of the most common causes of sudden vision changes is a detached retina, which occurs when the retina, the light-sensitive layer at the back of the eye, pulls away from its underlying support tissues. But vision changes can also be a sign of other eye conditions, such as macular degeneration, glaucoma, and cataracts. If you're experiencing any sudden or significant changes in your vision, don't wait to see if it gets better on its own. Consult an eye doctor immediately for a comprehensive eye exam and appropriate treatment. Wow, we covered a lot today. We talked about 10 silent signs your body might be in trouble, from unusual fatigue to persistent headaches and everything in between. Remember, your body has a way of telling you when something's not quite right. It's up to you to listen and take action. Let's quickly recap those 10 signs. Unexplained fatigue, frequent urination, unexplained weight loss, persistent cough, skin changes, shortness of breath, persistent headaches, chest pain, digestive issues, and vision changes. If you're experiencing any of these symptoms, especially if they're severe, persistent, or accompanied by other worrisome signs, don't ignore them. Schedule an appointment with your doctor to get checked out, and as always, thanks for watching. Don't forget to like, subscribe, and hit that notification bell so you don't miss out on future videos. Watch next, Top 10 Healthy Habits for a Longer, Happier Life.